Introduction to elder care. Elder care encompasses a wide range of services and support provided to older adults to meet their unique needs and enhance their quality of life. This field is crucial due to the global increase in life expectancy and the growing elderly population. Effective elder care aims to promote independence, dignity, and well-being, addressing both physical and psychosocial aspects of aging. It involves a multidisciplinary approach, often including medical professionals, social workers, and direct care providers. Understanding the fundamentals of elder care is the first step towards providing compassionate and professional support to seniors. This course will equip you with foundational knowledge and practical skills. The primary goal of elder care is to ensure that older individuals can live comfortably and safely, whether in their own homes, assisted living facilities, or nursing homes. It focuses on preventative measures, chronic disease management, and supportive services tailored to individual preferences and conditions. This includes assistance with daily activities, medication oversight, nutritional support, and emotional companionship. The evolving landscape of elder care requires caregivers to be adaptable, knowledgeable, and empathetic to the diverse needs of the elderly population. Understanding the aging process. The aging process is a complex biological phenomenon characterized by progressive physiological changes that occur over time, leading to a decline in functional capacity. These changes are highly individualized, influenced by genetics, lifestyle, environment, and health history. Key biological theories of aging include cellular senescence, telomere shortening, and oxidative stress, which contribute to the gradual deterioration of tissues and organs. Understanding these underlying mechanisms helps caregivers anticipate and address age-related health challenges. It is essential to recognize that aging is not a disease, but a natural progression of life. Psychological and social aspects of aging are equally significant, impacting an individual's mental health and social interactions. Older adults may experience changes in cognitive function, emotional regulation, and social roles, such as retirement or loss of loved ones. These transitions can lead to feelings of isolation, depression, or anxiety if not properly addressed. Caregivers must understand these multifaceted changes to provide holistic support, fostering resilience and promoting continued engagement in life. Recognizing the diversity within the aging population is crucial for personalized care. Common health conditions in seniors. Older adults are prone to a variety of chronic health conditions that require careful management and ongoing care. Cardiovascular diseases, such as hypertension and heart failure, are prevalent, often necessitating medication adherence and lifestyle modifications. Diabetes, another common condition, requires diligent monitoring of blood sugar levels and dietary control to prevent complications. Arthritis, a degenerative joint disease, causes pain and stiffness, impacting mobility and daily activities. Understanding the symptoms, progression, and management strategies for these conditions is fundamental for effective elder care. Early detection and consistent care are vital. Respiratory illnesses like chronic obstructive pulmonary disease, COPD, and pneumonia are also significant concerns, especially in older individuals with weakened immune systems. Neurological conditions, including Parkinson's disease and stroke, can severely affect motor skills, speech, and cognitive function, requiring specialized rehabilitative care. Additionally, osteoporosis, a condition causing brittle bones, increases the risk of fractures. Caregivers must be adept at recognizing signs of worsening conditions and collaborating with healthcare providers to ensure optimal health outcomes. Comprehensive knowledge empowers better support. Medication management for elders. Medication management is a critical aspect of elder care, as older adults often take multiple prescriptions, increasing the risk of adverse drug reactions and interactions. Proper management involves understanding each medication's purpose, dosage, frequency, and potential side effects. Caregivers must ensure strict adherence to prescribed regimens, using tools like pill organizers and medication charts. It is also vital to be aware of over-the-counter drugs and supplements, as these can interact with prescribed medications. Accurate record keeping and clear communication with healthcare providers are paramount to prevent errors and ensure safety. Polypharmacy, the use of multiple medications, is a common challenge in elder care, often leading to confusion and reduced adherence. Caregivers should regularly review medication lists with pharmacists or doctors to identify potential redundancies or inappropriate prescriptions. Educating seniors and their families about medication safety is also a key responsibility. Recognizing signs of adverse reactions, such as dizziness, confusion, or unusual fatigue, and knowing when to seek immediate medical attention are essential skills. Effective medication management significantly contributes to the overall health and well-being of older adults. Nutrition and hydration for seniors. Proper nutrition and hydration are fundamental to maintaining health and preventing illness in older adults. Nutritional needs can change with age due to decreased metabolism, reduced physical activity, and altered taste perceptions. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains is crucial for providing essential vitamins and minerals. Caregivers must be aware of dietary restrictions or specific nutritional requirements related to chronic conditions like diabetes or heart disease. Encouraging regular, nutrient-dense meals and snacks is vital for energy and overall health. Monitoring food intake helps prevent malnutrition. Hydration is equally important, as seniors are more susceptible to dehydration due to a reduced sense of thirst and changes in kidney function. Adequate fluid intake, primarily water, helps maintain bodily functions, prevent constipation, and support cognitive health. Caregivers should encourage consistent fluid consumption throughout the day, offering a variety of healthy beverages. Recognizing signs of dehydration, such as dry mouth, fatigue, or confusion, is critical for timely intervention. Implementing strategies to make meals and drinks appealing can significantly improve nutritional and hydration status in older adults. Personal care and hygiene. Assisting with personal care and hygiene is a fundamental aspect of elder care, preserving dignity and preventing infections. This includes helping with bathing, grooming, oral care, and dressing, always respecting the individual's privacy and preferences. Caregivers must ensure a safe and comfortable environment during these activities, using appropriate assistive devices like shower chairs or grab bars. Maintaining good hygiene is crucial for skin integrity, preventing skin breakdown and pressure ulcers, which are common in less mobile seniors. Gentle handling and clear communication are essential throughout these tasks. Oral hygiene is particularly important, as poor dental health can lead to systemic infections and nutritional deficiencies. Caregivers should assist with brushing, flossing, and denture care, ensuring regular dental checkups. Dressing assistants should consider comfort, ease of movement, and personal style, promoting self-expression. Additionally, incontinence management, including regular toileting and proper use of absorbent products, is vital for comfort and skin health. Providing personal care requires patience, empathy, and a keen eye for changes in skin condition or overall well-being. These practices support both physical and emotional health. Mobility and fall prevention. Maintaining mobility is crucial for older adults' independence and quality of life, but it often declines with age due to muscle weakness, balance issues, and chronic conditions. Caregivers play a vital role in encouraging safe movement and assisting with transfers, using proper body mechanics to prevent injury to both themselves and the senior. Regular, gentle exercise, tailored to individual capabilities, can help preserve strength and flexibility. Understanding the proper use of assistive devices like walkers, canes, and wheelchairs is also essential for supporting mobility. Promoting activity helps maintain physical function. Fall prevention is a paramount concern in elder care, as falls can lead to serious injuries, including fractures and head trauma. Identifying and mitigating environmental hazards, such as loose rugs, poor lighting, and cluttered pathways, is a key responsibility. Caregivers should also be aware of intrinsic risk factors, such as medication side effects, vision impairment, and gait instability. Implementing strategies like regular vision checks, reviewing medications, and ensuring appropriate footwear can significantly reduce fall risks. Education on safe movement and prompt response to falls are critical components of a comprehensive fall prevention plan. Cognitive changes and dementia care. Cognitive changes are a common part of aging, ranging from mild memory lapses to more significant impairments like dementia. Dementia is an umbrella term for a group of symptoms affecting memory, thinking, and social ability severely enough to interfere with daily life. Alzheimer's disease is the most common form of dementia, characterized by progressive neurodegeneration. Caregivers must understand the different types of cognitive decline and their impact on an individual's behavior and functional abilities. Early recognition of symptoms and appropriate intervention are crucial for managing these conditions effectively. Dementia care requires a specialized approach focused on maintaining dignity, reducing agitation, and promoting engagement. Communication strategies, such as using simple language, maintaining eye contact, and validating feelings, are vital for connecting with individuals experiencing cognitive impairment. Creating a structured and predictable environment can help reduce confusion and anxiety. Activities tailored to cognitive abilities, such as music therapy or simple puzzles, can stimulate memory and provide enjoyment. Caregivers must also be prepared to manage challenging behaviors with patience and understanding, always prioritizing the safety and well-being of the individual. Compassionate care makes a significant difference. Communication with older adults. Effective communication is the cornerstone of quality elder care, fostering trust, respect, and mutual understanding. Older adults may experience hearing loss, vision impairment, or cognitive changes that affect their ability to communicate effectively. Caregivers should use clear, concise language, speak slowly, and maintain eye contact to ensure messages are understood. Active listening, allowing ample time for responses, and asking open-ended questions encourage seniors to express their thoughts and feelings. Validating their experiences and emotions, even if they seem irrational due to cognitive decline, builds rapport and reduces frustration. Nonverbal communication, such as body language, facial expressions, and touch, plays a significant role in conveying empathy and support. A calm demeanor, gentle gestures, and a reassuring presence can communicate more than words. Adapting communication strategies to individual needs, such as using visual aids for those with hearing loss or simplifying choices for those with cognitive impairment, is essential. Patience and respect are paramount, recognizing that communication challenges do not diminish an individual's worth or intelligence. Successful communication enhances the care experience for both the senior and the caregiver. Emotional and mental health support is a vital component of holistic elder care, addressing the psychological well-being of older adults. Seniors may face unique challenges such as grief, loss, social isolation, and chronic illness, which can contribute to depression, anxiety, or loneliness. Caregivers should create a supportive and empathetic environment, encouraging open expression of feelings without judgment. Recognizing the signs of mental health issues, such as persistent sadness, withdrawal, or changes in sleep patterns, is crucial for timely intervention. Providing a listening ear and validating their emotions can make a significant difference. Promoting social engagement and meaningful activities is essential for maintaining mental health. Connecting seniors with peers, family, or community groups can combat isolation and foster a sense of belonging. Encouraging hobbies, creative pursuits, or light physical activity can boost mood and cognitive function. Caregivers should also be aware of resources for professional mental health support, such as therapists or support groups, and facilitate access when needed. A proactive approach to mental health support enhances overall quality of life and resilience in older adults. Compassion and understanding are key. Social engagement and activities. Social engagement and participation in meaningful activities are vital for the physical, cognitive, and emotional well-being of older adults. Isolation and loneliness can lead to significant health declines, including increased risk of depression, cognitive impairment, and cardiovascular disease. Caregivers should actively encourage and facilitate opportunities for seniors to interact with others and pursue their interests. This can range from simple conversations and shared meals to organized group activities and community outings. Understanding an individual's past hobbies and preferences helps tailor suitable engagement strategies. Activities should be adapted to the senior's physical and cognitive abilities, ensuring they are enjoyable and stimulating rather than frustrating. Examples include reading or listening to audiobooks, gardening or light household tasks, playing board games or puzzles, attending community events or religious services, engaging in creative arts like painting or music. These activities not only provide mental and physical stimulation, but also foster a sense of purpose and belonging. Promoting social connections and active participation is a cornerstone of person-centered elder care, significantly enhancing quality of life. Creating a safe home environment. Creating a safe home environment is paramount for preventing accidents and ensuring the well-being of older adults, especially those with mobility or cognitive impairments. This involves conducting thorough home assessments to identify and mitigate potential hazards. Key areas of focus include eliminating tripping hazards, like loose rugs and cluttered pathways, ensuring adequate lighting, especially in hallways and stairwells, installing grab bars in bathrooms and near toilets, securing electrical cords and removing obstacles. These modifications significantly reduce the risk of falls and other household injuries. A proactive approach to home safety is essential for independent living. Beyond physical modifications, caregivers must also consider other safety aspects, such as fire prevention and emergency preparedness. Ensuring smoke detectors and carbon monoxide alarms are functional and easily accessible is crucial. Developing an emergency plan, including contact numbers and evacuation routes, provides peace of mind. For individuals with dementia, additional safety measures like door alarms or secure outdoor spaces may be necessary to prevent wandering. Regularly reviewing and updating safety protocols helps maintain a secure and supportive living space for older adults. A safe environment promotes independence and reduces caregiver stress. Assistive devices and technology. Assistive devices and technology play a transformative role in enhancing the independence, safety, and quality of life for older adults. These tools range from simple aids to advanced electronic systems designed to compensate for age-related declines in vision, hearing, mobility, or cognition. Examples include walkers, canes, and wheelchairs for mobility support, hearing aids and amplified phones for communication, magnifiers and large print devices for vision assistance, adaptive eating utensils and dressing aids for personal care. Caregivers must be knowledgeable about various devices and how to properly use and maintain them. Proper selection and training are crucial for effectiveness. Modern technology offers even more sophisticated solutions, such as remote monitoring systems, smart home devices, and personal emergency response systems, PERS. These technologies can provide peace of mind for both seniors and their families, enabling independent living for longer. Telehealth services also allow for remote medical consultations, improving access to care. Caregivers should stay informed about new advancements and help seniors integrate appropriate technologies into their daily routines. The goal is to empower older adults to remain active and connected, leveraging technology to overcome physical and cognitive barriers. This integration fosters greater autonomy and security. Legal and ethical considerations. Legal and ethical considerations are fundamental to providing responsible and respectful elder care, ensuring the rights and dignity of older adults are protected. Key legal documents include advance directives, living wills, healthcare power of attorney, guardianship or conservatorship orders, financial power of attorney. Caregivers must understand these documents and respect the senior's wishes regarding medical treatment and financial decisions. Adhering to privacy laws, such as HIPAA in the United States, is also crucial when handling personal health information. Ignorance of these legal frameworks can lead to serious consequences. Ethical principles, such as autonomy, beneficence, non-maleficence, and justice guide decision-making in elder care. Autonomy emphasizes the senior's right to make their own choices, even if caregivers disagree, unless there is a clear risk of harm. Beneficence involves acting in the best interest of the senior, while non-maleficence means avoiding harm. Justice ensures fair and equitable treatment. Caregivers often face ethical dilemmas, such as balancing a senior's desire for independence with safety concerns. Open communication, ethical training, and seeking guidance from supervisors or legal professionals are essential for navigating these complex situations. Upholding these principles ensures compassionate and lawful care. Care planning and coordination. Care planning and coordination are essential processes in elder care, ensuring that all aspects of a senior's needs are met in a structured and integrated manner. A comprehensive care plan outlines specific goals, interventions, and responsibilities for medical, personal, social, and emotional support. This plan is developed collaboratively with the senior, their family, and a multidisciplinary team of healthcare professionals. Regular assessment of the senior's changing needs is crucial for updating the care plan, ensuring it remains relevant and effective. A well-structured plan promotes continuity of care. Effective care coordination involves seamless communication and collaboration among all individuals involved in the senior's care. This includes doctors, nurses, therapists, social workers, and family caregivers. The care coordinator acts as a central point of contact, facilitating information exchange, scheduling appointments, and ensuring that services are delivered efficiently. Coordination helps prevent fragmented care, reduces duplication of efforts, and optimizes resource utilization. The ultimate goal is to achieve the best possible health outcomes and quality of life for the older adult, while also supporting their family. This integrated approach is key to successful elder care. Family involvement and support. Family involvement is a cornerstone of effective elder care, providing crucial emotional, practical, and financial support to older adults. Family members often serve as primary caregivers, advocates, and decision-makers, playing an indispensable role in the senior's well-being. Caregivers must recognize and respect the family's role, fostering open communication and collaboration. Understanding family dynamics and cultural backgrounds is important for building trust and ensuring a harmonious care environment. Engaging families in care planning and decision-making processes empowers them and strengthens the support network. Supporting family caregivers is equally important, as they often face significant physical, emotional, and financial strain. Providing resources, education, and respite care can help prevent caregiver burnout and ensure the sustainability of care. This includes connecting families with support groups, counseling services, and community resources. Caregivers should also facilitate communication between family members and healthcare providers, ensuring everyone is informed and aligned with the senior's care goals. A strong partnership between professional caregivers and family members creates a comprehensive and compassionate support system for older adults. This collaborative approach benefits everyone involved. End-of-life care and palliative support. End-of-life care and palliative support focus on providing comfort, dignity, and quality of life for older adults facing life-limiting illnesses. Palliative care aims to relieve suffering and improve quality of life for patients and their families, regardless of the stage of illness. It addresses physical, psychological, social, and spiritual needs. End-of-life care, a specific type of palliative care, is provided in the final stages of life, typically when a cure is no longer possible. Caregivers must approach this sensitive area with profound empathy, respect, and understanding. Open discussions about wishes and preferences are crucial. Key aspects of end-of-life care include pain and symptom management to ensure comfort, emotional and spiritual support for the senior and family, assistance with advanced care planning and decision-making, maintaining dignity and respect for the individual's choices, bereavement support for families after loss. Caregivers play a vital role in creating a peaceful and supportive environment, ensuring the senior's comfort and honoring their wishes. This requires sensitive communication, active listening, and collaboration with hospice teams and other healthcare professionals. Providing compassionate end-of-life care is one of the most profound responsibilities in elder care, offering peace during a difficult time. Cultural competence in elder care. Cultural competence in elder care is the ability to understand, appreciate, and effectively interact with individuals from diverse cultural backgrounds. Older adults come from a wide array of cultures, each with unique beliefs, values, and practices regarding health, illness, family roles, and end-of-life decisions. Caregivers must recognize that cultural differences can impact communication styles, dietary preferences, personal care routines, and acceptance of medical treatments. Developing cultural sensitivity helps provide person-centered care that respects individual identities. It is crucial to avoid stereotypes and generalizations. Achieving cultural competence involves self-awareness of one's own cultural biases and assumptions, knowledge of different cultural practices and beliefs relevant to elder care, skills in adapting communication and care strategies to cultural contexts, openness to learning from and about diverse cultures. Caregivers should engage in respectful dialogue, ask open-ended questions, and utilize cultural resources or interpreters when necessary. Understanding cultural nuances helps build trust, reduce misunderstandings, and ensure that care is delivered in a way that aligns with the senior's values. This approach enhances the effectiveness and appropriateness of care, promoting better health outcomes and satisfaction for older adults from all backgrounds. Stress management for caregivers. Caregiving for older adults, while rewarding, can be incredibly demanding and lead to significant stress, burnout, and emotional fatigue. Caregivers often juggle multiple responsibilities, face emotional challenges, and may neglect their own well-being. Recognizing the signs of caregiver stress, such as irritability, exhaustion, changes in appetite or sleep, and feelings of resentment, is the first step towards effective management. Ignoring these signs can lead to serious health consequences for the caregiver and negatively impact the quality of care provided. Prioritizing self-care is not selfish, but essential. Professional boundaries and ethics. Establishing and maintaining professional boundaries and adhering to ethical principles are paramount in elder care to ensure the safety, respect, and trust of both the senior and the caregiver. Professional boundaries define the limits of the relationship, distinguishing it from personal friendships or family ties. This involves maintaining appropriate distance, avoiding dual relationships, and refraining from personal disclosures that could burden the senior. Clear boundaries protect vulnerable older adults from exploitation and ensure that care remains focused on their needs. Understanding these limits is crucial for professional conduct. Ethical conduct in elder care is guided by principles such as respect for autonomy, honoring the senior's right to make decisions, beneficence, acting in the senior's best interest, non-maleficence, avoiding harm, confidentiality, protecting personal information, justice, ensuring fair and equitable treatment. Caregivers must navigate complex situations with integrity, always prioritizing the senior's well-being and rights. This includes reporting suspected abuse or neglect, maintaining professional demeanor, and seeking supervision when ethical dilemmas arise. Adhering to professional boundaries and ethical guidelines builds a foundation of trust and respect, essential for high-quality, person-centered elder care. These principles safeguard both parties. Documentation and record-keeping. Accurate and thorough documentation and record-keeping are indispensable practices in elder care, ensuring continuity of care, legal protection, and effective communication among the care team. Detailed records provide a comprehensive history of the senior's health status, care interventions, and responses to treatment. This includes daily care logs, e.g., vital signs, food intake, personal care, medication administration records, incident reports, e.g., falls, changes in condition, communication notes with family and other professionals. Proper documentation supports informed decision-making and accountability. It is a critical component of professional care. Maintaining confidentiality and adhering to privacy regulations such as HIPAA are paramount when handling sensitive personal and health information. Records should be organized, legible, and updated regularly, reflecting any changes in the senior's condition or care plan. Electronic health records, EHRs, are increasingly used to streamline documentation and improve accessibility for authorized personnel. Caregivers must be trained in proper documentation procedures and understand the legal and ethical implications of their records. Accurate record keeping not only protects the senior and the caregiver, but also ensures that care is consistent, high quality, and tailored to individual needs. It serves as a vital communication tool. Infection control in elder care. Infection control is a critical aspect of elder care, as older adults are more susceptible to infections due to weakened immune systems and the presence of chronic conditions. Implementing strict infection prevention practices is essential to protect both seniors and caregivers. Key measures include frequent and thorough hand hygiene, washing with soap and water, or using alcohol-based sanitizer, proper use of personal protective equipment, PPE, like gloves and masks, environmental cleaning and disinfection of surfaces, safe handling and disposal of contaminated materials. Adherence to these practices significantly reduces the transmission of pathogens. Vigilance is paramount in preventing outbreaks. Caregivers must also be aware of common infections in elderly populations, such as urinary tract infections, UTIs, pneumonia, and skin infections, and recognize their signs and symptoms promptly. Early detection and reporting to healthcare professionals are crucial for timely treatment. Vaccination against influenza and pneumonia is also an important preventative measure for both seniors and caregivers. Education on infection control principles and consistent application of these practices are vital for maintaining a safe and healthy environment. A proactive approach to infection control safeguards the vulnerable elderly population. This commitment to hygiene protects everyone. Emergency preparedness for seniors. Emergency preparedness is a critical aspect of elder care, ensuring the safety and well-being of older adults during unforeseen events such as natural disasters, power outages, or medical emergencies. Seniors are often more vulnerable during emergencies due to mobility limitations, chronic health conditions, and reliance on medications or medical equipment. Caregivers must develop comprehensive emergency plans tailored to the senior's specific needs. This proactive planning can significantly reduce risks and improve response times. Preparing for various scenarios is essential. Key components of an emergency plan include an emergency contact list with family, doctors, and emergency services, a go bag containing essential medications, medical supplies, food, water, and important documents, knowledge of evacuation routes and designated meeting points, instructions for operating medical equipment during power outages, a plan for communication if regular services are disrupted. Regularly reviewing and practicing the emergency plan with the senior and their family is crucial. Caregivers should also be trained in basic first aid and CPR. Being prepared for emergencies provides peace of mind and ensures that older adults receive timely and appropriate assistance when it matters most. This readiness is a testament to dedicated care. Advocacy for elder rights. Advocacy for elder rights is a fundamental responsibility in elder care, ensuring that older adults are treated with dignity, respect, and fairness, and that their voices are heard. Seniors, especially those who are vulnerable or have cognitive impairments, may be at risk of abuse, neglect, or exploitation. Caregivers have a moral and ethical obligation to protect these rights and act as advocates when necessary. This involves understanding the various forms of elder abuse, physical, emotional, financial, and neglect, and knowing how to recognize and report them. Vigilance is key to safeguarding well-being. Advocacy also extends to ensuring access to appropriate healthcare, legal services, and social support. Caregivers can advocate by speaking up for the seniors' preferences and wishes in care planning, helping seniors understand their rights and available resources, connecting them with legal aid or elder protective services, challenging discriminatory practices or policies, empowering seniors to self-advocate whenever possible is also a crucial aspect. By actively championing elder rights, caregivers contribute to a society where older adults can live free from harm with autonomy and respect. This commitment to justice is a hallmark of compassionate care. Career paths in elder care. The field of elder care offers a diverse and growing array of career paths, driven by the increasing global aging population and the demand for specialized services. These roles cater to various skill sets and levels of education, from direct care to administrative and clinical positions. Understanding the different opportunities available can help individuals align their passions and qualifications with a fulfilling career. The sector provides opportunities for continuous learning and professional growth, making it an attractive field for those dedicated to helping others. It is a sector with significant impact. Common career paths in elder care include Certified Nursing Assistant, CNA, or Home Health Aide, HHA, Licensed Practical Nurse, LPN, or Registered Nurse, RN, specializing in geriatrics, social worker, or case manager for seniors, occupational or physical therapist specializing in gerontology, activities coordinator or program director in senior living facilities, administrator or manager of elder care facilities. Each role contributes uniquely to the well-being of older adults, offering opportunities for direct impact, leadership, or specialized clinical practice. Further education and certifications can open doors to advanced roles and greater responsibilities. The elder care sector is dynamic and continuously evolving. Continuing education and development. Continuing education and professional development are indispensable for elder care professionals, ensuring they remain updated with the latest best practices, research, and evolving needs of older adults. The field of gerontology is constantly advancing, with new medical treatments, technological aids, and care methodologies emerging regularly. Engaging in ongoing learning allows caregivers to enhance their skills, expand their knowledge base, and provide the highest quality of care. This commitment to lifelong learning benefits both the caregiver and the seniors they serve. It is a hallmark of professional excellence. Opportunities for continuing education include workshops and seminars on specialized topics, e.g., dementia care, palliative care, online courses and certifications, conferences and professional association memberships, advanced degrees or specialized training programs. Investing in professional development not only improves individual competence, but also opens doors to career advancement and leadership roles. Caregivers should actively seek out learning opportunities that align with their career goals and the specific needs of their clients. A commitment to continuous improvement ensures that elder care professionals can adapt to challenges and provide compassionate, evidence-based care throughout their careers. This dedication fosters innovation and quality.